The COVID-19 pandemic triggered a global economic collapse, and Guyana was no exception to the efforts. The cost of living rose, prices for food increased, putting a strain on the average man. Coupled with the events surrounding the March 2, 2020 general and regional elections, havoc unfolded, leading to hundreds of persons dying from the disease. But after assuming office, the People's Progressive Party Civic (PPPC) administration made tremendous strides towards economic recovery. Several measures were implemented to ease the cost of living, including stabilizing the food prices locally. In its 2020 emergency national budget, making financial resources available to improve testing capabilities and to acquire critical pharmaceuticals was government's focus. Measures to ease the burden on citizens included the $150 million to support frontline workers, reverse value-added tax on electricity and water for pensioners, mortgage interest relief increased in the limit for low-income loans for corporate tax relief in the banking sector from $8 million to $10 million, and the provision of a $25,000 COVID cash grant per household, among other initiatives. Further, in its first full-year budget in 2021, additional measures were implemented to ease the cost of living and reverse several punitive taxation measures. That plan also catered for countrywide development and rapid economic stimulation. Key measures included reducing the cost of basic food and other household items, reducing the cost of construction materials and home ownership, removing VAT on data for residential and individual use, and removing duty on all-terrain vehicles, ATVs, for use in the hinterland. Fast forward to March 2022, after nearly 2 years of restrictions on social, physical, and economic activities to curb the spread of COVID-19, the government announced the removal of all restrictions, clearing the way for a complete rebound of economic activities. This is in addition to several key measures outlined in the 2022 national budget geared towards accelerating economic growth and recovery. The excise tax on gasoline and diesel was reduced from 20% to 10%, while the vulnerable were supported through the introduction of the dialysis support program, where each dialysis patient was receiving $600,000 annually. Public assistance increased from $12,000 to $14,000, benefiting 18,000 persons and providing an additional $432 million in disposable income. Old age pension was further increased from $25,000 to $28,000, placing an additional $2.3 billion of disposable income into the pockets of senior citizens. Additionally, the Because We Care cash grant increased from $15,000 to $25,000 per child, placing $2 billion in the homes of 200,150 children. Now students are receiving $40,000 from the government to offset their expenses for school, $35,000 under the Because We Care cash initiative, and $5,000 for school uniforms. The monthly income tax threshold also increased from $65,000 to $75,000 monthly, thereby releasing a total of $1.3 billion into the hands of current taxpayers, both in the public and private sectors. Billions were also pumped over the years to support the comprehensive COVID-19 vaccination program, which has resulted in a significant decline in COVID-19 cases.